personally and how you're concerned.
Good afternoon, Chairpersons Rivera and Holden, and members of the Hospitals and Technology Committees. My name is Varoon Mathur, and I currently serve as a Technology Fellow at the AI Now Institute, an interdisciplinary research institute at NYU focused on the social implications of artificial intelligence. Thank you for the opportunity for me to testify today on privacy and security concerns regarding electronic health records. The rapid development and implementation of machine learning algorithms and data sharing partnerships to the healthcare space bring new challenges around privacy, security, and patient identifiability through EHR data. These new developments raise two key questions. One, how does our definition of protected health information, or PHI, change in the age of AI algorithms, given their predictive capabilities, which can disclose sensitive information even absent PHI? And two, how do we assess the utility of EHRs in building more advanced algorithms for better patient care? New research suggests that the rapid development and deployment of clinical AI tools, absent regulatory oversight, leaves patients vulnerable to privacy and security breaches. Under HIPAA, PHI data is categorized as data that directly and uniquely ties to an individual, with examples including names, birth dates, and email addresses. De-identified data, therefore, would be the removal of such categories from a potential EHR dataset. However, new research shows that it is possible to link two de-identified EHRs of the same patient but from two different data sources accurately using computational methods so as to create a complete history of a patient without using any PHI of the patient in question. Similarly, last month, a New York Times article reported new research that showed it is possible to create a reconstruction of a patient's face using de-identified MRI images that could then be identified using facial recognition systems. These examples demonstrate how vulnerabilities within large technology infrastructure present serious security and privacy challenges for the collection and use of EHR data, and that these may be beyond the reach of HIPAA protections. But trading the privacy and security of individual patients in order to leverage precision clinical care incorrectly assumes that EHR data are inherently viable for training of machine learning algorithms and models. Research, for example, conducted by Dr. Elizabeth Kazunis, a postdoctoral fellow at AI Now, demonstrated the ways in which the social construction of health data result in a failure to capture important types of health information for the patient. Given the large number of world-class health systems in New York City, this committee has a unique opportunity to spearhead citywide legislative efforts that can address current challenges. We provide 3 forward-looking policy recommendations that this council could pursue, which are detailed in my written testimony. But 1, require New York City health systems procuring AI and ML solutions to conduct algorithmic impact assessments as part of notifying and obtaining consent from patients. 2, require New York City health systems to publicly state whether social media data is combined with EHR data for patient surveillance or monitoring of patient well-being. And 3, conduct citywide disparate impact evaluations around the current uses of EHRs in order to identify potential socioeconomic disparities arising from the use of AI and ML health solutions with EHR data. Thank you very much.
Thank you so much for your testimony. And I just want to ask about AI Now. So can you tell me a little bit about the group?
Yeah, absolutely. Thank you for the question. The AI Now Institute is an interdisciplinary research institute that focuses on trying to understand the social impacts of technology, especially artificial intelligence, within communities. So we have a team of research scholars that focus on the law and policy aspects of artificial intelligence, the historical significance of artificial intelligence within communities, how are communities impacted through ethnographic data that we collect and share, that we collect and publish as a research institute. And we also talk about the security and privacy concerns around AI as it impacts how we define and think about surveillance and security. We are also, just to add, we are housed at NYU, so we're an academic research institution.
Thank you. I want to recognize we've been joined by Dr. Matthew Eugene. In terms of I just have one more question for you about this because you are studying AI, and we all know that it's here. It's been here actually for a long time, and it's as common as writing an email, right? Are you looking at how, I guess on a grander scale, would you say that the technology that is being used specifically and directly related to EHR is probably one of the greatest threats to how you look at data and how it impacts adversely certain communities that have historically, I guess, been under threat?
Yeah, thank you for the question. There's a key example that I detail in my written testimony at the end, where a recent team from Berkeley were able to show that that algorithms built on top of patient data showed that an algorithm was recommending less care for Black patients based on the fact that healthcare costs were used as a proxy to understand how high risk a patient would be. That's problematic because even though the EHR data might be capturing some patient information, it's not capturing the problem within the socio-technical context, which is that Black patients on average are getting less access to care. And so we see electronic health records as being marketed as this new promise for big data analytics, in which hospital systems might be tempted to think that better patient precision care could be built upon EHRs. And new research now is showing, at least from what we're seeing, is that this is highly problematic without proper auditing.
Thank you. Thank you for kind of reading into my question and being very honest about some of the data and those results and outcomes that we know have historically impacted poor communities of color. Are there any questions from members of my committee? Yeah.
Dr. Thompson, thank you for coming all the way here to New York City with information. Now, you use Epic.